We're going to cover a case study today of sitbone pain. Sitbone pain is right into this area right here. It feels super deep. It doesn't feel like it really goes to the hamstring, but a lot of times people will feel it with sitting, running, walking, and hamstring workouts. I'm Sebastian, part of locally world famous chiropractors in Costa Mesa, California. Today we're going to cover not only the case presentation, but also a couple things that we did in regards to rehabilitation for this case. This person's had it for, I think it was more than 5 years, and it was just something that wasn't getting better with soft tissue work. No matter how much active release or stretching they were doing, it was really not getting any better. And so we were thinking about doing soft tissue work, active release on them, but as we found through the exam, it was not going to be the right thing to do, and I'll show you how the exam will usually go. Normally, the location of the symptom is not the only thing that you need to be paying attention to, but it's also how it responds to certain movements of areas around the body. There's a test that we have called a straight leg test. It's something that every doctor, physical therapist, chiropractor that's working with you for your hamstring should be using to assess to figure out where your problem is coming from. Straight leg test is pretty simple. Normally the person is laying on the table and the doctor raises the leg to the point of tension and then they move the foot. Obviously, if there's any clinicians watching this, my knee is not locked. I know that, but I'm also not performing it on myself. So it goes up and it goes like that. So normally what this assesses is, we call it neural tension. Is there any part of your problem that's coming from a nerve-based problem? And it's really easy to figure out if it is that, because the results don't make any logical sense for things like a hamstring or things attaching to the sit bone, or actually anything around the sit bone, whether it was a bursitis or like a tendinopathy up in the area. So here's what the results you tend to expose. The leg goes up, they feel tension, the foot goes down, and all of a sudden they say, "Oh, that's my sit bone pain." And then the toes release, and they say, "Oh, it went away." And then they go down again, and it says, "Oh, the sit bone pain," and then it releases. And so here's how the logic goes with this. The hamstrings is mainly the thing attached to the sit bone. Obviously, we can argue and say maybe it's something other than that locally in the area, but let's just play devil's advocate here. What connects from the ankle to the sit bone? Not the hamstrings, because the hamstrings don't go that far. Skin, blood vessels, nerves, fascia, bone doesn't go that far. Burses don't go that far. So what the heck? So that's one thing. Also, sometimes head movement changes it too, which doesn't make any sense either. And so if you think logically with it and think, well, what attaches there, it helps you identify better of what you should treat or how you should intervene first. With this person, we identified that it was going to be more of a nerve-based complaint, and we did a simple thing of flossing her nerve. Okay, nerve flossing is pretty simple, and the good thing is the test that you do helps you identify if there's still sliding in effect. Because not everybody still has a sliding mechanism of the nerves. Some people, when you move their head, it doesn't change anything. Other people, when you move their ankle, it really doesn't do anything either. But most people will have some type of slide mechanics in play. And you can figure out with the test, if the test goes on and off and on and off and on and off and so on, up here, then you can identify, well, there's some slide mechanics in play. It just doesn't tolerate tension, because this is what puts the nerve at tension. It also puts the fascia tension back there too. Either way, we're going to slide things a little bit. And so the way you would do this is toes down, look down. Toes up, look up. Basically, if you imagine like a big old cord going from my ankle behind my back to my head, every time I pull with my foot, it pulls my head back. Every time I pull with my head, it pulls my foot down. And so this is really basic flossing protocol. Normally people that do it can find that their range of motion touching their toes gets better. They find that the exercise that once provoked it before, like running, doesn't really bother it anymore. But the trouble is that the results don't necessarily stick all the time. This is just one version of what we call a first aid. It restores some sliding that you need because your nerve doesn't tolerate the opposite, which is tension. And so by allowing it to slide, it stops the tensioning. Imagine that vacuum cleaner cord. You let one side go and it pulls, but if you plug in both sides, then it tensions. And so we have to stop the trigger somehow, and the trigger tends to be tension in this scenario. So normally what we do after that is we need to build support around the hip, because if the nerve is at tension and doesn't like the tension, we need to figure out why it's doing that. And it usually comes down to some type of non-painful dysfunctional region that's not really doing the work, but also it doesn't hurt either. Here's what we commonly find with it. Let's see, I'll do it from a kneeling position just because I don't have a camera person. Imagine I'm standing. Normally we'll do something called a SFMA, which is a movement assessment. We'll have the person bring their arms over their head as far as they can, and we'll just look to see where their movement's coming from. A lot of times people will move from their back and their hips really don't move, versus letting their hips move and getting like a nice uniform curve. It doesn't have to be perfect, but we want to see ideally where you're moving from. If you're moving from your back, then a lot of times people will have back pain, back stiffness, and they'll have these scenarios where they'll have sit bone pain, but it's more related to nerve tension than anything else. I should clarify that usually when people have this, it's very correctable. Treatment is very simple. It's just hard. You have to put some work in. But usually they don't need medication or surgeries of any type. But we see people like this all the time at Performance Place. And as you can see in the video, you can see when people move certain ways. So doing assessments on virtuals really does work well for us, but we invite you to come in person if you'd like to meet us. So take advantage of any of the free gifts that come up on the side or any of the videos that we have for you. We have literally like 400 or 500 videos on YouTube. So subscribe to the channel and check out all the great stuff that we had to offer. We'll see you guys next time. Take care.